members of staff and friends who are listening by webcast. This event is being live streamed. My wife and daughters in the audience, lots of friends, ladies and gentlemen. I stand before you here today on the second anniversary of the signing of the Intergovernmental Agreement. I stand before you feeling very deeply honored and privileged to be leading this new agency. I thank God for this opportunity to be of service, and I thank all my mentors along the way who have shaped me for this task. I feel a bit humbled. I feel a bit scared when I consider the challenge involved in making the Integrated Public Health Agency from the 5 former institutions, each with decades of valuable service. But I'm also very excited. It is the best job in the world. At the potential for our work to make a difference in people's lives in the Caribbean, to prevent disease and disability, to promote and protect health. This has always motivated me in my public health career, which has spanned the UK, the United Kingdom National Health Service, the Caribbean at CARPHA, the US Centers for Disease Control, and the Pan American Health Organization. In delivering our mission, we will be deepening the Caribbean cooperation in health and helping to advance the Caribbean brand on a global stage. And we are on a global stage, given modern communications and given the travel and tourism industry, where diseases can move from one spot of the world to another within 24 hours. So we are and will be working with the Caribbean Tourism Organization on this and other tourism and health matters. Many persons have worked long and hard for this child to be born, and I'm still discovering. Jerome Walcott, my immediate predecessor, Sir George, Dr. Green, Minister Ramsamy from Guyana, Myrna Bernard, Rudy Cummings from CARICOM, Dr. Roses, Dr. Gross from PAHO, and Dr. Carissa Etienne, the new director of PAHO. I thank her for advice and help to date, and I know that with her at the helm, we have someone who will help this child to grow up to be strong and healthy and wise and in favor in the eyes of everyone. Well, maybe the tobacco industry is not going to favor us. At this point, the words of a wise person come to mind in discovering many had been at work. You have labored hard, and I have come to help you reap the harvest. And that's the spirit of servant leadership that I bring to this post. Many partner agencies also deserve thanks. Some have been mentioned: Canada, Public Health Agency and DFAID, the US CDC, Public Health England, Argentina, we were there last week, Australia, I hope will be counted as a partner, and the European Union deserving special mention for the core institutional strengthening that we are working with them on, and of course the government of Trinidad and Tobago for support for the new facility. And yet, despite all that has happened, as the Calypsonian Tambu said, the journey now starts. And what a journey it promises to be. It's going to be a journey where many can and will contribute, and where the crew, the staff of CARPHA, to use Dr. Elaine's analogy, have a place to grow and reach their individual and collective potential. That's certainly one of my ambitions for the agency. We face many challenges to our development in changing health and environment and economic situations, and with new and emerging diseases always a threat. We also have a much more informed and more demanding people in our countries. So we have to maintain and innovate in our surveillance and response mechanisms, including building a pan-Caribbean laboratory network that monitors disease, monitors the environment, monitors pharmaceutical quality, and triggers appropriate responses. But we have faced complex challenges before, and we can build on these successes like the immunization program. We punched above our weight 20 years ago when we eliminated measles in this region. In so doing, we led the world. The value of this initiative continues to accrue every year. And so I say, invest in CARPHA, and so we can continue the good work. I believe it's within the scope of this agency to really make a difference in the Caribbean, to improve health and well-being, reduce inequalities, and reduce the upward cost spiral in health services, improve prospects for Caribbean people. In so doing, I hope that the agency will become a recognized player on the global public health field. combining practices from north and south and from in between. From a technical point of view, we can realistically aim to prevent premature death from NCDs, from HIV/AIDS and injuries and violence by at least 25% by 2025, and include this as part of our post-2015 development targets for the Caribbean. We can do this by strengthening services we currently provide and focusing on implementing cost-effective prevention policies informed by good data and by research into what the problem is, what works, and working with partners in government, in civil society, in academia, and private sector. We also recognize that in implementing our strategies, we need to take account of multisectorality and opposed interests. Not every interest is aligned with what we're trying to do. To achieve our goals will require investment from member states and partners in the work of CARPHA and in building the human and information systems capacity in public health in member states. The field epidemiology training program that we're about to launch with support from the US Centers for Disease Control is a good example. I say hold us accountable for the results and invest in us, as disease prevention and health promotion are the most cost-effective investments in universal health coverage. As a small agency facing a large task, partnership and networking will be key, and I will pursue this approach strongly as the director to include civil society as an equal partner. I take opportunity to say hello to Professor Trevor Hassel, Chairman of the Healthy Caribbean Coalition. Last week, Thursday, I saw your note that PM Portia Simpson-Miller of Jamaica had signed a petition calling for an end to cervical cancer, and I felt really happy to see that. We fully support your petition. In our partnering strategy, I do want to signal there are some clear exceptions, such as the tobacco industry and those with interests in tobacco, which is fundamentally opposed to health. In fact, we aspire to a tobacco-free Caribbean where all public spaces are smoke-free. And this is getting closer to being a reality. Trinidad and Tobago, Barbados, Suriname, and very recently Jamaica have implemented smoke-free spaces. With respect to cervical cancer, one of our member states, Haiti, has the highest rate in the world. In a recent visit that I made there, including the Secretary General of CARICOM, this subject was one of the priority issues discussed. Haiti will get special attention from CARPHA as the member state having the most needs, but there's also a willingness and an energy there to deal with them. The Caribbean Commission on Health and Development, chaired by Sir George, in its report to CARICOM heads in 2005, noted 3 super priorities in health: HIV/AIDS, non-communicable diseases, and injuries and violence. We've made a lot of progress against HIV and AIDS. It's almost remarkable. We are systematically tackling the problem of NCDs. However, injuries and violence have grown worse in recent years in most member states, particularly homicide, linked to a range of causes including alcohol and illegal drug trafficking. We have not yet taken a strong public health approach to this problem. When I was the director at CAREC, I was significantly involved in the advocacy and fight against HIV and AIDS. I recall visits made to many cabinets and parliaments with colleagues from the University of West Indies Health Economics Unit and the Caribbean Regional Network of People with HIV to raise awareness and to speak to the head, the heart, and the pocket of cabinets. I pledge that CARPHA will help to finish the fight against HIV and AIDS. As head of the NCD program in PAHO for the last 6 years, I fought to raise awareness and mobilize member states in the fight against NCD. I felt so proud. It was February 2010 when in New York at the UN, the proposal was made by Trinidad and Tobago on behalf of CARICOM states for a United Nations high-level meeting on NCDs, and it was accepted. That was a glorious moment. I pledge CARPHA will continue the fight against NCDs, integrating the new WHO targets for NCD into our strategic plan and focusing on the best buys, like tobacco and alcohol control, like reducing salt and trans fats in our diet, working in partnership with CARICOM, with PAHO, and with others. With respect to NCD, it's clear that we must also place strong emphasis on childhood obesity prevention and take firm policy measures to protect the health of children. We always have. Recently, I also agreed with the Caribbean Office of Trade Negotiations to hold a joint meeting of trade and health officials early next year. Most of the food we eat is imported. You can do more to adjust diet through adjusting trade policy. At the other end of the age spectrum, given the aging of our populations and increasing dementia, we must also focus on healthy aging. I see one of my classmates here who is the head of the WHO Collaborating Center on Aging. For injuries and violence, the trends that we see for homicide are cause for great concern. You see, injuries and violence not only harm the families and the individuals, but it's spawning an epidemic of fear. People spend money on burglar bars and private security forces, which are not productive uses of resources. I pledge that CARPHA will take up the fight against injuries and violence, beginning as we always do in public health. You study the problem, its causes and its determinants. You push for and support implementation of prevention policies and programs. In partnership with others, such as the Impact Regional Agency, we can combine security-oriented measures with public health measures like reducing harmful use of alcohol, like developing life skills in children and adolescents, and promoting gender equality to prevent violence against women. Our work in health and development must also give priority to environmental health, including the maintenance of water and sanitation programs, and to go beyond and take further steps to protect the health of the environment. It's the only planet we have. Pharmaceutical quality is another area of focus, and a Caribbean policy has been adopted by ministers to ensure access to safe, effective medicines of good quality, used rationally for people of the region. Building on the work of CRDTL, CARPHA will work on strategies that help to implement this policy. In concluding, this agency has a rich tradition of 5 former regional health institutions to build upon. There is so much potential. We must pursue it vigorously. We must complete the transition of the 5 into 1 and then move beyond it to craft a new vision in collaboration with member states. Many will help to implement that vision. Financial sustainability will be key to ensure that we are properly capitalized for delivering our public health and development mission. We call upon all our partners, and especially investment banks, to assist us in becoming financially strong and sustainable. I pledge that CARPHA will be well managed with good stewardship of resources, and I pledge to work together with countries, with CARICOM and PAHO and partners to address the public health challenges of our region. I thank you.